Your body is giving you signals right now that most people completely misread, and some of them are way more serious than just needing a shower. We're talking about smells that can hint at your genetics, your metabolism, a bacterial infection, or in one case, a medical emergency that can sneak up on you fast. So in this video, we're going over 7 body odors you genuinely should not ignore, and I'm not just going to list them and move on. For each one, I'm going to tell you what's actually causing it, what the research says, and what you can actually do about it. Some of these are going to surprise you because a few of them have nothing to do with hygiene at all. Let's start with something that comes up constantly in the comments. People saying they still smell bad after showering. And if that's you, I want you to hear this clearly. It does not mean you're dirty. Here's what's actually happening. Sweat by itself doesn't really smell that much. The odor you're picking up is what happens when bacteria on your skin break down sweat, oils, and compounds from your apocrine glands into stronger-smelling chemicals. So you can shower, smell totally fine for a little while, and then the smell comes back, because the bacteria rebuild fast. Cleveland Clinic and Mayo Clinic both explain this, and Mayo Clinic specifically recommends antibacterial soap for body odor, not just regular soap. The shower resets things temporarily, but if the bacteria population bounces back quickly, the smell follows. And here's the part almost nobody mentions. Genetics can affect how much underarm odor you're likely to produce. There's a gene called ABCC11 that's linked to both earwax type and underarm odor tendency. People with the wet earwax variant are more likely to produce the kind of underarm sweat that bacteria can turn into odor. But this does not mean wet earwax automatically means you smell. Bacteria, sweat volume, hormones, clothing, hygiene, and mixed genetics still matter. The real point is this. Some people are biologically more likely to give odor-causing bacteria more material to work with. That is not a character flaw, it is biology. This will be discussed more later on in the video. So, the fix isn't just shower more, it's about reducing the bacteria that are doing the breaking down. Use an antibacterial wash on the zones that tend to hold odor: armpits, feet, groin folds, under breast folds, inner thighs. And here's one a lot of people don't know. A benzoyl peroxide wash, used a few times a week on armpits or feet, can actually kill surface bacteria really effectively. Baylor College of Medicine has noted this specifically. Just be careful. It can irritate skin and it will bleach your towels and dark clothing, so rinse thoroughly and don't let it sit on fabric. Also, let the cleanser actually sit on your skin for a minute before rinsing. Don't just splash and go. Dry the area completely after, because bacteria thrive in moisture. And use antiperspirant, not just deodorant. Deodorant covers the smell. Antiperspirant reduces the sweat itself, which gives bacteria less to work with. And wash your clothes properly, because a clean armpit pressed against a bacteria-loaded shirt will bring the smell right back. But here's where it gets more interesting, because for some people, the problem isn't just bacteria, it's that their skin is almost always wet. Hyperhidrosis is excessive sweating beyond what your body actually needs for cooling. The American Academy of Dermatology says it commonly shows up in 1 or 2 specific areas, usually underarms, hands, feet, face, or head. And when your skin is constantly damp, you're basically giving bacteria a permanent feeding ground. So a person with hyperhidrosis can have great hygiene and still struggle with odor because the moisture never stops. Mayo Clinic notes that a change in how much you sweat can actually signal something worth checking out. If this sounds like you, start with a clinical-strength antiperspirant and use it at night. That's when it works best because your sweat ducts are less active. Wear breathable fabrics and change damp shirts or socks as soon as you can. For hands and feet specifically, there's a treatment called iontophoresis that a dermatologist can walk you through. For underarms, prescription antiperspirants, medicated wipes, Botox injections, and even energy-based treatments are all real options. The AAD lists them. And if the sweating is sudden, happens all over your body, wakes you up at night, or comes with things like weight loss, fever, chest pain, or tremors, that's worth bringing to a doctor because those can point to secondary causes. Now, speaking of sweat that catches people off guard, have you ever noticed that nervous sweat seems to smell worse than regular sweat? That's not your imagination, and there's actually a reason for it. When you're emotionally stressed, your body can activate apocrine glands, especially in your armpits. These glands release a thicker fluid compared to the kind of sweat you produce just from being hot. And that thicker fluid is something bacteria can break down into stronger odor. Mayo Clinic notes that stress and hormonal changes can both trigger sweating and body odor through this pathway. So anxiety sweat hits differently, literally, because it's coming from a different system. The practical side of this: use antiperspirant the night before situations you know will be stressful, so your sweat ducts are already better controlled going into the day. Breathable undershirts or sweat-blocking undershirts can help a lot in high-anxiety situations. Cutting back on caffeine can reduce how much you sweat overall. And if anxiety is driving constant sweating, deodorant alone isn't going to fix it. The loop goes: nervous, sweat. Fear of smelling, more sweat. Breaking that loop sometimes means addressing the anxiety itself through therapy, medication review, or in some cases, medical treatment for the hyperhidrosis that anxiety is triggering. Okay, this next one is genuinely fascinating and was briefly mentioned earlier: the connection between earwax and body odor. Sounds bizarre, but stay with me. There's a gene called ABCC11, and research has found a strong association between this gene, your earwax type, and your tendency toward underarm odor. Specifically, people with the wet earwax variant of this gene tend to have more active apocrine glands, which means more of the kind of sweat that bacteria can turn into odor. A study on axillary osmodrosis, which is the medical term for strong armpit odor, found a clear link between wet earwax ABCC11 genotypes and underarm odor. Now, I want to be careful here because this is easy to oversimplify. Wet earwax doesn't automatically mean you smell. Bacteria, sweat volume, hormones, hygiene, clothing, and mixed genetics all still play a role. But it does mean some people are genetically more likely to produce the kind of sweat that bacteria can convert into odor. And that's not a hygiene failure. That's just biology. If you're someone with strong genetic underarm odor, regular deodorant may genuinely not be enough. Prioritize antibacterial washing, antiperspirant, and fabric control. Keeping armpit hair trimmed can also help because odor clings to hair. And if it's severe, a dermatologist can talk to you about bromhidrosis treatments specifically designed for this. That's important to understand, but there's another type of body odor that confuses people even more, because no amount of washing seems to touch it. If you or someone you know has noticed a persistent fishy smell that seems to come through sweat, breath, urine, and saliva no matter what, that's a different situation entirely. There's a condition called trimethylaminuria, sometimes called fish odor syndrome, where the body has trouble processing a compound called trimethylamine. Instead of breaking it down properly, the body excretes it, and it comes out through multiple channels at once. Cleveland Clinic explains that the smell can come through sweat, breath, saliva, and urine. And that treatment can include avoiding certain trigger foods, using specific soaps or lotions, medication, and mental health support, because the social impact of this condition can be severe. Certain foods can make it worse in people who have this: fish, obviously, but also eggs, beans, soy products, peanuts, broccoli, cauliflower, and other high choline foods. But, and this is important, don't start cutting out a long list of foods without medical guidance because choline is nutritionally essential. The right move is to track whether the smell gets worse after specific meals, and then ask a doctor about urine testing for trimethylamine. The smell coming through your sweat, breath, and urine simultaneously is a clue that this isn't a skin problem. It's a metabolic one. If you're finding this useful, drop a comment and tell me which one surprised you most. It genuinely helps the video reach more people who need to hear this. And if you want to keep going, I have another video on health signals your body sends that most people ignore completely. I'll link it at the end. Now, back to something more visible, or at least more detectable. If your feet smell absolutely terrible and you've noticed small crater-like pits or punched-out dots on the soles of your feet, that may not be regular foot odor. There's a bacterial skin infection called pitted keratolysis, and DermNet describes it as a superficial bacterial infection characterized by those crater-like pits and really strong malodor. Cleveland Clinic also describes it as a bacterial infection that causes foul odor and tends to affect people with sweaty feet or shoes that don't breathe well. Most people assume bad foot odor is either athlete's foot or dirty socks, but pitted keratolysis is bacterial, not fungal, and it needs a different approach. Look for tiny pits, white soggy-looking skin, or those crater-like dots on the soles. Keep your feet as dry as possible. Change socks regularly, rotate your shoes so they can dry out between wears, and go for breathable materials. An antiseptic cleanser or benzoyl peroxide wash can help. And if the pits and odor persist, a doctor can prescribe topical antibiotics that actually target the bacteria causing the infection. If sweaty feet are the trigger, treating the sweating is part of the solution too. And finally, this last one. I want you to take it seriously. A fruity smell on someone's breath, or something that smells like nail polish remover, can come from ketones. If someone is fasting, doing a keto diet, or restricting calories heavily, their body starts burning fat for fuel and produces ketones as a byproduct. That can cause a fruity or acetone-like smell on the breath, and if the person feels fine and knows why it's happening, it's usually not a problem. But, and this is the part that matters, in someone with diabetes, that same smell can be a sign of diabetic ketoacidosis, which is a medical emergency. DKA can develop fast. Cleveland Clinic lists fruity-smelling breath alongside vomiting, abdominal pain, rapid deep breathing, weakness, confusion, and decreased alertness as DKA symptoms, and says to seek urgent care if those symptoms are present. This is not a wait-and-see situation. So, if someone has fruity breath and they're intentionally fasting or doing keto and they feel completely fine, probably just ketosis. But if there's diabetes in the picture, or if that smell comes with high blood sugar, vomiting, confusion, extreme thirst, or rapid breathing, check blood sugar and ketones immediately and get medical help. The smell of a medical emergency and the smell of a diet side effect can be the same smell. Context is everything. So let's bring it all together. Smelling after showering is often about bacteria rebuilding fast, not about being dirty. Hyperhidrosis keeps skin wet and feeds odor bacteria constantly. Nervous sweat uses a different gland system that bacteria love. Your earwax type can hint at a genetic tendency toward underarm odor. A fishy smell through multiple channels at once may be a metabolic condition, not a hygiene issue. Tiny pits on the soles of your feet with terrible odor may be a treatable bacterial infection. And fruity breath needs context, because in the wrong situation, it's urgent. At the start of this video, you probably thought most of these were just hygiene problems. But most of them aren't. They're biology, genetics, and in some cases real medical conditions with real treatments. And knowing the difference is what actually helps. If this video helped you, subscribe. I cover this kind of stuff regularly, and the next one is worth sticking around for. Drop your questions below too, because a lot of this video came directly from comments on previous videos, and yours might end up in the next one.